Good evening, everyone. I'm Keishla Adderley, and welcome again to the Bahamas Tonight, the National Report. Topping news this evening, COVID-19 cases in the Bahamas have exceeded 4,000. 101 confirmed cases reported by health officials yesterday, 97 of them here in the capital. The Ministry of Health will hold a press conference at 3 o'clock tomorrow afternoon to update the country on the latest numbers. Meantime, health officials have emphasized that limiting cases in the capital can be achieved through discipline and adhering to safety protocols. In this report, Altavi's Munnings tells us how things have changed since emergency orders have been relaxed.
With some restrictions in the emergency powers COVID-19 orders being relaxed in New Providence, like going to the beach, inter-island travel, and simply going to the food store, health officials have found that interaction has led to the increase in COVID-19 cases on the island. For the past few days, the Health COVID-19 dashboard has shown that New Providence is generating more positive cases than any other island in the country.
We all know what is required. This isn't an issue of only putting it upon the government or the Prime Minister or other officials. I think it really is in a public education and having the public take responsibility for our own actions. It affects us as individuals, it affects us as families, it affects us as communities. And so we can't continue to look to someone else to have to put in punitive measures for us to do the right thing. We have to realize that we know what works in the Bahamas. We know if we can stay home, we can stay away from social activities, if we can pick up our food and go, if we can minimize the amount of people in crowded spaces to include weddings and funerals and church services and the like. If you know that that's what works, we can just do that on our own.
Is the Bahamas still in its second wave of COVID-19, or would you say we are now starting the third wave?
No, I think we are definitely continuing our second wave. We have not seen relief of the activities in New Providence for sure since we started having additional cases in mid-July. So we definitely cannot say that we've ever come out of that second wave.
Recovered cases seem to be on the rise as 65 additional cases were reported in the past 24 hours, bringing the total to 2,206. Deputy Chief Medical Officer Dr. DeLon Brennan also noted that there was an increase in hospitalized cases for the same time period.
We have have had at times more than 100 people within the past week being hospitalized on a particular day. That is a large number for us. We know we already have crowded health systems, and our facilities aren't able to, on a normal day, handle the level of volume of patients in an efficient manner. And adding this on top of that only worsens the situation both for those who have COVID and also for those who are coming in for non-COVID related issues. So we definitely don't have a good story so far to tell related to hospitalization.
The COVID-19 death toll increased by 1 to 96 as health officials confirmed the death of a 75-year-old male resident of New Providence who passed away this week. Dr. Brennan noted that COVID-19 death rates are higher in the Bahamas than the first wave, but are consistent with global figures.
We know we have a population that has many chronic non-communicable diseases, and with the higher rate of non-communicable diseases come higher rates of death. And so what we're seeing now is just consistent with what has happened around the world.
Altavi's Munnings, ZNS Network News.